Well, welcome everybody as we join in for what promises to be an enthralling evening of spreadsheets and numbers and percentages. But I do appreciate you taking the time. As you heard when you signed on, we are recording this session. We're going to make this one available via the website. Um, and so we will have a little bit of time. I'm going to stop the recording. Someone will probably need to remind me to stop the recording in case there's any questions that are very specific to your situation. You'd rather not have them on the recording. So we will make an allowance for that. I do want to highlight a couple of the folks who are on the call who are also on COM. Ben is here tonight. He's on COM. Becky's on COM. Frank is on COM. Holly Ray is on COM. Bucky's on COM. Jessica is on COM. Tyler's on COM. So we are very well represented tonight with our COM folks for this session tonight. So the basic flow of this is going to be kind of a presentation where I'm going to walk you through a slideshow. Then we're going to jump over to the actual minimum terms of call document that we've prepared. And then we'll take time for some recommendations and questions. I do want you to know at the outset, like what you're seeing today is different than what we've showed the 3 previous times, based on some of the input that we've gotten on the way things were presented and information that we've received. We have changed and updated not the numbers themselves, but the formatting and some of the ways that we're presenting this, as we're trying to make this as clear and straightforward for everyone as we can. So I would kind of ask you to hold questions until the end, but we will have plenty of time for questions. So without further ado, we will get started. All right. So here's the basic flow of what we're going to do. We're going to go through the presentation, then we're going to get into questions, and then we're going to get into recommendations and feedback. What I should say before we get started at all is that special thanks to our Pastoral Vitality subcommittee, that is Ben Schneider, who also is our COM co-chair, Steve Wilson, Jennifer Floyd Williams, Louise Shoppy, and Doug Ports. That team put in some extra effort at the end of April and into the beginning of May. We had a couple extra Zoom meetings, a lot of email exchanges, and that helped us be way ahead of the curve, actually, as far as our COM in responding to the changes the Board of Pensions had made and getting policies and procedures out in place. Just yesterday, there was a presentation, there was an email sent to all the mid-council leaders around the country from another mid-council leader that was like, well, I guess we probably should get started on figuring out what we're going to do about the Board of Pensions changes. And I was very, very grateful for the folks on that team who put in the extra effort way back in April and May so that we are ahead of the curve with the information that we're presenting to you today. So before we go further, we need to define a term here. And this is equality versus equity. And you can see the graphic there that kind of shows it. In equality-based systems, everyone receives the same, regardless of what they need. In an equity-based system, everyone receives what they need, okay? And the reason that this is relevant is that the system that we are used to, I'm gonna put this back up, the system we are used to has been a equity-based system. And there's a lot of advantages to an equity-based system. And I've already misspoken. We've been in an equality-based system, and we're moving toward an equity-based system. But what happens when you move from an equality system to an equity system is it gets more complicated. And so that's the first thing I need to say. This is more complicated than we have had to deal with within the world of clergy compensation within the PCUSA. Now, for those of you who have lived outside of the clergy world of the PCUSA, you will say, well, welcome to the normal world. We understand that. We're just acknowledging that this is a more complicated system than we've had to deal with in the past. So where do we start? Presbyteries, per the Book of Order, are required to establish minimum terms of call for pastoral positions, as well as certified Christian educators. And minimum terms of call are comprised of 4 parts. Direct compensation. This is basically cash that is paid directly to the pastor in the form of salary. housing allowance or a manse, but most of the time housing allowance, and seek a offset. Expenses, things like professional expenses and continuing education that are made available as reimbursable accounts. Time, vacation and study leave. And finally, benefits, mainly in the form of Board of Pensions dues. And as I said, the current benefits plan is an equality-based system. And starting in 2025, the goal is an equity-based system. In most years, the Commission on Ministry has voted to increase minimum terms consistent with the cost of living adjustment. And we've looked at, federal government papers, talked to peer presbyteries, done some research and said, okay, what's the percentage that we need to increase? And under the old system, when you increased the salary, all the other numbers basically fell into place. It was a percentage-based system. The percentage was the same for everybody. It was relatively simple. But this year, with a change in the Board of Pensions medical plan, we knew we needed a more thorough revisioning of the minimum terms of call. In the current program, regardless of a pastor's marital or parental status, congregations have paid for family medical coverage. This coverage has provided security for pastors and their families. Likewise, congregations had the assurance that the medical and retirement needs of a pastor and family were provided for. Equality. Everyone gets the same, regardless of need. And while this was required for installed positions, our COM had mandated non-installed positions receive equality and benefits as well. So that was not a Book of Order requirement. In the Book of Order, there are no specific requirements for non-installed positions. But our COM had said, no, we don't want installed versus uninstalled to have a disparity, and therefore we made the minimum terms the same for both. Beginning in 2025, here are the major changes. For those in installed positions, only the pastor is required to be enrolled in the benefits plan. Medical coverage for spouses and dependents can be purchased through the Board of Pensions at an additional fixed cost. And given different family settings and needs, the changes in the medical coverage will be different for everyone. So what has COM and specifically Pastoral Vitality been wrestling with? Well, they've been wrestling with a couple things. One is to understand the implications for our churches and for the pastors of our presbytery. Number two, with possible ways to adapt to the new Board of Pensions plan, and to develop a way to provide minimum terms of call for pastors with different family settings. What has made this more complicated is this concept of call neutrality. Call neutrality has basically said that the bottom line cost for a congregation should be the same regardless of a pastor's given needs. And because the Board of Pensions the current system, was percentage-based, that was easy to enforce, okay? So if you've ever been in a PNC or part of a session, you would know that one of the things that a congregation had to decide, a session had to decide, is what was the range in salary a church was prepared to offer a pastor. It was very simple. It was from minimum terms of call up to, let's say, 65,000 or 70,000 or whatever. It didn't matter any of the details. It was just set a minimum salary, a maximum salary, and you were done, because we had an equality-based system where the percentages just, everything fell into place. The upcoming changes to medical benefits and the variety of options and financial implications have made maintaining call neutrality to be much more difficult. In this new and challenging situation, we are sensitive to the continuation of medical benefits for pastor spouses and children where needed. We are also cognizant of the financial needs and challenges our local congregations experience. So one of the things to understand is that the presbytery is comprised equally of minister members and congregations. Right in the Book of Order, it says a presbytery is made up of ministers and congregations. And the Commission on Ministry has an equal obligation to identify and to represent the interests of both our pastors and our congregations, okay? And that inherently makes this difficult, because for pastors, usually what is better for them, often what is better for them individually, is going to end up costing our congregations more. And so we have always lived in this balance of saying, how can we do right and be just with our pastors and also not impose a burden upon our congregations that makes sustaining ministry not basically impossible. Okay? And that is one of the challenges, and this change is actually going to make that harder, not easier. On the one hand, given a certain set of circumstances, it'll be easier. On the other hand, it will be harder. But we felt very strongly that we needed a system that would not incentivize the calling of those who do not need additional coverage for a spouse, children, or family members. We felt very strongly about that we needed to find a way to maintain some semblance of call neutrality. In an effort to provide opportunity for churches to have certainty in knowing the cost of hiring a full-time pastor while keeping positions open equally to applicants regardless of their benefit needs, the Commission on Ministry is proposing a plan that equalizes cost among all categories of medical benefits while seeking to maintain the flexibility the new medical plan structure provides. So one of the goals of the Board of Pensions was to reduce the cost of installed leadership for congregations. We did not believe it was right to undo that. We also, though, wanted to make sure that there was some semblance of an equal playing field. And so what we came up with was this approach that is benefits-based minimum terms of call. The effect of this plan introduces variability, not in the total cost to the church budget, but in the effective cash salary which is paid to the pastor depending on the medical benefit choice. Salary variability, not my phrase, but a brilliant phrase, puts the important decision making regarding family medical benefits in the hands of a pastor seeking a call and avoids positions being advertised by congregations based on medical benefit needs. It allows churches to approach a call neutrally, regardless of a candidate's medical benefit needs, and for pastors to require dependent medical coverage, this recommendation shifts the cost of medical premiums for spouses and families away from effective salary. It thereby reduces tax liability as well as Board of Pensions dues paid liability by making the full cost of benefits employer paid. Okay, now there's a lot in that paragraph, and later on I'm going to break it all down. But basically, what we tried to do here was hold all these tensions together. We need to hold the tension of how do we create opportunities for cost savings where it's necessary and helpful. How do we ensure our pastors receive a just and fair wage for given their background and preparation and credentials and responsibilities? And how do we empower our churches to be able to search for a pastor without having to have weird conversations of, well, we'll offer this, but not that, and thereby limiting the candidate pool. Okay? So, what do we need to acknowledge here at the outset? Number one, this new plan will benefit some in our presbytery and cause hardship for others. And the simple answer is this. For those who need family coverage, specifically family coverage, spouse and dependents, this plan is going to cause hardship for them and the churches they serve. For those who need spouse or dependent coverage, it's largely neutral. And for those who do not need spouse or dependent coverage, it is a net benefit for at least the congregations that they serve. This, by the way, does not fall into stereotypical categories. There are some of our younger pastors who are in a great position because the spouse has excellent benefits, and therefore they don't need to carry them. And they've been able to, instead of carrying medical benefits, they're now looking at exploring other options, including additional retirement savings plan contributions. It's also more of a challenge for some of our more experienced pastors who are carrying family coverage and where there's no other options for them to seek benefits. So it is not necessarily it doesn't fall neatly into stereotypes. Some of our small churches, again, depending on the pastor who serves them, are going to benefit tremendously. Some of our large churches who are served by pastors who don't need benefits are going to benefit tremendously. And we've got stories in all of these categories moving forward. But the first thing is this is a win for some, and it's going to be a challenge for others. The presbytery cannot attempt to undo the changes the Board of Pensions has made on a local level. Initially, people have said, so some ideas were put forward of what if we require payment into a shared cost fund that we then redistribute so that family coverage isn't in danger. And we constitutionally can't do that. Even per capita is not compulsory for our congregations. We cannot mandate payment into a fund of any sort as far as that goes. So we can't undo these changes, even if it were the will of COM and the presbytery as a whole to do it. This new plan will require pastors to evaluate what benefit options are best for their families in a way that they have never had to do before. That's the bottom line. I think a couple other things just to acknowledge about this before we keep going, right, is that Ben and I have put a lot of time into this, and one of the people who is like gonna be at most at risk is actually Ben and the church he serves. And so when people say, well, who's the poster child? In many ways, Ben's the poster child, right? And so the primary architects of this, I carry family coverage for my family. My situation is very different being on staff at, with the presbytery, but know that, I like this was the story for my family, right? When Renee and I got married, we had no kids. She was the only one that I was providing coverage for. And within 2 years, we had added 2 kids, and the church was carrying coverage for them. And under the old system, that was no big deal, right? It was a fixed percentage system, nothing changed. Under the new system, that would cause a major change in the impact to myself and the congregation. So know that as we were developing this, a lot of us sitting around that room thinking through this understand the implications of this because we're living it or have lived it, and we want everyone to know that. So what are the recommendations before the COM? One, we have minimum terms of call for 2025. There's 2 other ones, and we're going to take these actually first. One is to identify a suitable and appropriate insurance broker to assist pastors as they evaluate their benefit options. And number 3, to create a medical benefits benevolence fund. Okay, we're going to start with 3 and go to 2 and go to 1, but first you need to understand kind of the underlying belief behind the system. In our kind of documents that we're laying out these changes, we write this: Pittsburgh Presbytery is a covenant community of Jesus Christ that exists to assist and support the witness of our congregations and leaders. Well, within our covenant community, there's a range of financial capacity. We believe that no pastor should have to choose between their service as a pastor and the health and welfare of their family. And the challenge is this: under our current system, one of the ways that we maintain some sense of equity, of everyone getting what they needed, one way that we maintained cost sharing was through the benefits plan. So no matter what your salary was, you were enrolled in the same benefits plan as somebody making far less or far more than you. And in fact, depending on your salary, under the current system, there was actually a difference in your deductible to what you had to pay out of pocket. So the benefits plan was one of the ways that under the old system we maintained this equity, right? Not everyone's salary was the same, but everyone's benefits were. And this is a major shift. And so what this belief says is, look, that shift being made, we still believe that no one should say, okay, either I'm going to serve this church or I'm going to provide medical insurance for my family. We don't want any pastor to have to make that decision. Therefore, we are proposing establishing a medical benefits benevolence fund where the sole purpose of the fund would be to underwrite the costs of pastors who need additional health coverage but serve communities with limited financial capacity. Congregations and individuals could contribute to this fund, which would then accrue from year to year. In particular, congregations for whom the transition to the congregational pastor's plan, that's the new plan of the board, and will receive a cost savings, will be encouraged to contribute some of that savings to the fund as a visible sign of our connectional support and shared ministry within our covenant community. This fund would then be administered by COM, and the exact mechanics of how that would be done, honestly, would depend a lot on what the contributions are. If people contribute to the fund, we'll be able to provide a greater level of support to those who need additional coverage and serve those communities where the financial capacity to provide it simply is not there. Recommendation number 2, to approve a suitable and appropriate insurance broker to work with pastors and other employees employed by our churches. One of the interesting realities that we are facing here in the Pittsburgh market is we have nationally some of the lowest costs for health insurance across the country. So if you look at our costs because of the rivalry between Highmark and UPMC, family coverage, dependent coverage, etc., is lower here than it is in many major metropolitan areas in the country, and significantly lower than it is in some rural areas where insurance is very expensive. And therefore, sometimes the best option will not be to have family coverage through the Board of Pensions, especially for our non-installed folks. For our non-installed folks who do not have to be enrolled in the Board of Pensions benefits plan, the most cost-effective option may in fact be to not be enrolled in the Board of Pensions plan. Now, I've spent a lot of time since April working on health insurance, and here's what I can tell you. I have no interest in knowing anything more about the health insurance marketplace in this country than I already do. That is not our role. It is not what I want to learn more about. We have a set goal to identify somebody who does this, but you'll see suitable and appropriate, right? We're not just looking for anybody. We're saying, all right, let's find somebody who understands church, who understands pastors, and who's going to be honest with us about their commission structure, so that maybe if it comes down to that they receive some kind of payment directly from the presbytery, so that they're acting on a commission-free basis, so that they're working, so that we know that they're working for the best. If you've got questions about the details of this has not even been approved, right? So this is an idea that we are working on. So this person has not been identified. We don't have any details yet. This is the idea that we're working with, okay? So with that, there's 3 things I'm going to talk about here, and then we're going to switch over to the document. So first of all, we are recommending approval of the minimum terms of call as presented in the next appendix, but these are the next 2 that are important. To adopt the following policy, and this is really important for pastors who are currently installed or will be installed by year's end. Pastors currently enrolled or enrolled before the end of the year in Pastor's Participation Plan, that's the current plan, shall be enrolled in the Transitional Pastor's Participation Plan for 2025 unless the pastor chooses otherwise. What does this mean? Every one of our current calls was negotiated with the understanding that family coverage, if needed, would be available and provided by the church. And we do not believe it is right for that to change without the pastor making that choice. So if a pastor is currently enrolled in the plan, and unless they choose to go into the new plan, they get to move into the transitional plan. The transitional plan is structured just like the current plan. It provides full family coverage at a fixed percentage of effective cash salary. So it's the same structure. What we know is that this plan has a 3-year window. And this is, in the Board of Pensions word, a glide path toward the new plan, which everyone will need to be enrolled in starting January 1st of 2028, okay? But for pastors who are currently enrolled, unless they opt out, they shall be enrolled in the Transitional Pastors Plan. And we'll talk through this when we get through the actual documents. You'll see what this means. And last, this is for our congregations, to recommend that congregations who wish to seek a full-time installed pastor budget the total amount listed under 2025 plan with spouse of $91,076 or more. Doing so will ensure that they are able to offer any level of benefit coverage required by a pastoral candidate. Okay? So give me just a second. I'm going to close out of this part of the presentation. And switch documents. Okay, so in front of you now is the actual minimum terms of call document for next year. There was no point in trying to put all of this on slides. Actually, before I dive into that, I'm going to put in the chat a link to the document itself so that you can
There's something wrong with my computer.
so that you can open it on your end. So give me just a second to do that.
It's enthralling. I know, folks. We got this.
Yeah.
Don't worry. This is the 4th time Brian and I have done this.
Yeah. All right. In the chat is the direct link to the document that I have shared on screen. If it'd be easier to open that up and take a look at that. So this is very similar to what it looked like in the past, but this is important to understand. The Commission on Ministry is using 3 different terms in this year's document. Number 1 is required. This term is self-explanatory. Congregations are required to meet this level of compensation. Recommended means it will not mandatory. The Commission on Ministry believes that the compensation at this level increases the sustainability and health of a pastoral relationship. In other words, required you can do, but you're going to be very, very limited as a congregation at the required level. And goal means it will not mandatory, in some cases not feasible. This is the acknowledgement. Compensation at this level provides an equal salary for an individual, regardless of their need for benefits. Okay. You also can see what is in this policy, what was on the slides before about the transitional pastors policy, the budget recommendation, and just a clarifying point. It is the sole responsibility of the pastor to select options 1 through 5 on pages 2 and 3. That's basically an expansion of what it is, what was implicit in number 1. The pastor kind of chooses what plan to go into. This is what we mean here. Let me also say something that I should have said earlier, but I want to explain. One of the things that we believe is important and why we're putting so much decision-making power in the hands of the pastor is that we believe strongly that a pastor should not have to have conversations about family planning and marriage and things like that with their session or even their personnel committees. Okay. And I will give you a couple examples, right? If you are a pastor and it comes time to choose benefits, and at the time the pastor is just married, right? No dependents. The awkward conversation would become if the pastor says, "Well, I require family coverage." The response is, "But you don't have any kids. Why do we have to pay for family coverage?" Suddenly, now you've opened up a conversation that's very uncomfortable because perhaps the goal is for that not to be the case. Maybe the pastor or their spouse is already expecting but doesn't want to announce yet. Perhaps they're going through IVF and they don't know how it's going to end. Perhaps they're planning on getting married and that's not public knowledge yet. There's so many things that could be a factor in the pastor's life that we do not want those conversations to be forced in a way that will be uncomfortable and, to be frank, inappropriate for a pastor and their session to have. because we want to put the decision-making hands, or because we want the decision-making to rest with the pastor, we structured the terms of call as such to try and control that bottom line cost, right? So that we're not trying to then negotiate back and forth, and that'll become a little bit more clear. Also here, there's a link to the Board of Pensions decision-making guide, which is very good, and along with contact information for us. So let's start with this. For the transitional plan, these are people who are already enrolled and installed, or no, are already enrolled in the current pastor's participation plan. These are the terms of call for next year as proposed. Salary $57,800. The covenant package, 10%. What is that? The covenant package is the renamed pension, disability, and death and disability programs of the Board of Pensions merged into one category. So they used to be part of BOP dues that was 39%. We're now breaking them out and calling them either covenant package or income security package is the other way to look at it. It's the same three programs. Nothing's changing on the pension side, death and disability side, or temporary disability side. That remains at 10%. Base medical coverage at 33%. Seek offset and the expense allowances for a bottom line cost to budget of $91,076. Remember that number, it's going to show up a lot, okay? This is identical to how our terms of call are structured now. And for most of our pastors who need family coverage, the transitional plan and this set of minimums is going to be the best option for most. There's a couple exceptions, but for pastors who need family coverage, the transitional plan is going to be the best option, except for those who are at the very highest paid level, above $110,000 or so. Everyone else who needs family coverage, the transitional plan is the best option for 2025. And you can see those numbers in front of you. Fairly straightforward. However, if we get to what's called member only, where medical coverage will only be provided for the pastor, the numbers shift. The salary, $57,800, covenant package, $5,780. The base medical is now $9,248. You can see this is $19,074, $9,248. Significant cost savings on member only. Seek offset remains the same, expense allowances remain the same. But you can see the cost difference is about $10,000 from the bottom line cost of the transitional plan to the bottom line cost for member only coverage. This is the first time you're going to see this required versus recommended two-tier status. This is the required status. And we know for some of our churches, this required level is going to be a relief. It will allow the pastor to continue in a full-time call, and it will allow the church to be able to continue to provide that and continue to go about their ministry, where this difference, even in $10,000, is going to be a significant make or break difference for the church. We have those situations in our presbyteries. Okay, we know it. I've talked to people. Okay, so for some of our churches, this is going to be a net win because their pastor only needs member only coverage, and they would rather have a full-time call than have to look for a new one, do shared ministry, or go part-time. What we are recommending, though, is the column on the right. That's where that 91,076 number shows back up again. And here's why we're saying this is recommended. Because circumstances change for pastors. We don't like to think about these things, right? But spouses lose jobs, divorces happen, and in tragic circumstances, spouses can pass away. There's even some weirder circumstances out there. So not in our presbytery, but in another presbytery that I've worked with, they had a pastor who was member-only coverage. They were not married. They did not need coverage for any dependents. And then, in the midst of that, as they were making that decision, their sister suddenly passed away, leaving her with 3 children that she was now responsible for providing for. Suddenly, she needed plus children coverage, right? And so that's why for sustainability of call, compensating at a higher level ensures that should a change come in the needs of the pastor, things can be reconfigured, rather than either a massive financial hit to the church or a massive financial hit to the pastor. So that's why we're recommending the higher level, even though only the lower level is required. Third, member plus option, you can see the same two-tier structure. Not a lot of difference in bottom line cost here, 90,200 versus 91,076. And finally, the member plus spouse number. Again, that 91,076 number is there at, no, this member plus spouse, this is where the 91,076 number comes in. And finally, the most glaring and most difficult one to swallow is a member plus family option. As you can see, at this point, the salary is down significantly. We're down under 50,000 salary-wise under the new plan, okay? Now, this is why we are saying that if you are currently in a call and need family coverage, you should stay in the transitional plan. Because the transitional plan, for the same bottom line cost of the 91,076, provides full family coverage and a salary of 57,800. So you can see very clearly here, if you're eligible for the transitional plan, that's the plan to do starting in 2025. The goal is on the right-hand side, but you can see the significant cost difference. Under the new plan, to provide the same level of salary, this 57,800 number, the bottom line cost goes up to almost $102,000. Okay, so this kind of puts right in front of you. Here's kind of the stark difference that those who need family coverage are going to be at a significant disadvantage under this plan. Okay, this is part of the reason why we believe something like a medical benevolence fund is going to be crucial, because this level of salary will make it very, very difficult for some of our folks to continue in full-time ministry. And our hope is by doing some voluntary cost sharing, we're able to offset some of that so that full family coverage can be provided and a salary can be more fair and doable than what is being required here. In addition to salary, this is all kind of holdover from past language, $2,000 for expenses, study leave provision, vacation time, compliance with the parental and family leave policies. This is new to the minimum terms, but not new. We adopted it last year. The Presbytery's dissolution of terms policy and a review of the sabbatical leave guidelines that are there. So those are for installed positions. For our non-installed folks, the number has, we again have kind of the same two-tier system. We have a required system, we have a required level, and a recommended level. And in the recommended level, we have maintained this same bottom line cost equity between this and installed positions. So we are keeping that, so that equity is saying that the bottom line needs to be the same for installed or non-installed positions. We are keeping in the minimum terms of call going into this year. And everything else there is the same. The benefits policy, and this is just worth noting, all non-installed ministers employed more than 20 hours a week must be enrolled in the covenant package of the Board of Pensions. So this is a new requirement, but not really, because nearly all our pastors who are over 20 hours a week were already enrolled in those plans. We're just changing the vocabulary here. In addition, they must be offered benefits of equal value to member-only participation in the Board of Pensions Congregational Pastors Package for medical coverage. If a pastor does not need medical coverage, participation in some alternate benefit option must be provided. Participation in the Retirement Savings Plan 403B of the Board of Pensions is suggested as an alternative to medical coverage, right? So if there's a situation where a pastor says, I don't need medical at all, and I'm not in an installed position, the COM is strongly recommending for sustainability that the total cost savings not be realized by the congregation and an additional form of benefit compensation be provided to the pastor. Because if there's a change in circumstance or that pastor moves on, the change in cost could be very disruptive to the life of the congregation. All right, you have seen enough screen sharing, and I've gone a little longer than even I liked, so I'm going to stop and pause. I'm going to ask Ben to chime in with anything that he wants to share that I missed, and then we'll open the floor to questions and comments from people.
I don't think you missed anything. I think I pretty much covered what we've gone on before. Before we get into the questions and comments, we want to end the recording.
Let's record the first round of questions and then I'll pause it at the end.
Yep.
Are there any questions that anyone has? I'm not seeing any.
Nope.
Okay, in that case, I am going to end the recording. The one thing I want to say before I end the recording is this: in a lot of cases, this is a very specific, particularized situation. Here's the circumstances for our church and for our pastor. Walk us through. And we have developed kind of a three-level plan here at Presbytery office for how we're going to kind of handle this. If you have questions specific to your church, start with your branch minister. So call Ralph, call myself, or call Louise. If you don't know who your person is, if you're in the north, it's Ralph. If you're in the west, it's Ralph. If you're in the south, it's Louise. If you're in the east, it's me. And we have done enough that we can walk you through the basics. If you contact Ralph or Louise and they don't know the answer, they're going to send you to me. I've spent more time on this than they have. They're going to send you to me. If I don't know it, we're going to send you to Emily Chuddy, our Board of Pensions consultant. And especially for really particular, unique situations, it's going to end up in Emily's hands. We are trained and equipped. We have the knowledge that we need to handle, I would say, 90% of the situations with our churches and our pastors. We can help you figure out with the decision-making guide from the board. We can help you figure out the best option for you and figure out what to do. But in other cases, our Board of Pensions rep stands ready to answer any questions that we can't, and we are prepared to, and we are prepared to do that. So, all right, I'm going to end the recording, and then I'm going to get to Patrice.